My name is Dr. Zaheer Babar. I've been practicing alternative medicine for over a decade, and this is a medical segment with Dr. Zaheer Babar. So today I will explain about heart attack. Before to understanding heart attack, we need to understand what is the heart disease, and then it lead to the heart attack. So here I designed the heart of the patient. So how is it? Approximately heart have the weight of 300 gram, we can say. The body of like an apple, you can say an apple, and not more than 300 grams. So, and we have, I will explain now how the heart attack occur. First, I need to explain what is the heart disease. So this is the heart of a normal patient. So there are the big tube which we call aorta. It's coming here, and then from the back it come to here, and it's supplied to the chest, and then to the kidney, liver, and this go to the legs, and this is come back to the heart. So this is the main circulatory system. So we have three tubes inside which we call coronary arteries. So how the heart disease start? So I will explain. Here I draw the coronary artery. So when the heart disease start, the first step like this, blockage start from here to here and is come here, and in the second stage it start this cholesterol fats is start blocking till here, and artery block like here till here, and in the third stage it come to here. And this, when it start like here, little blockage, and then little bit more, and this, and then this called heart disease. And there is, we have upper layer of this which we call intimal membrane. So the cholesterol is covered by this layer which called intimal membrane. So this is when it start occur, this cholesterol start blocking the artery. It can be here on the right side, it can be on the left side, or anywhere can be start depositing the cholesterol. So this is heart disease. And now we have to understand when the heart attack occurs. So I will explain by the simple language. I will explain like this. When we have this cover up, this, when it will burst, the clotting will come here. And when clotting come, there will be the 100% blockage. Before that, I want to explain a normal heart, a normal person, the heart, when we are sitting, we need only 10% of the blood in the heart. We will be not feel any symptoms. And when we stand and little bit walking, we need 20%. And when a normal person is running, so he need a 30%. So I can say, if the person have a 70% blockage, he can be running normally. So if he have a 80% blockage, he can be walking normally. So the normally patients come when they have the blockage more than 70%. So that's why the people, they don't know before that they have a heart disease. So the symptoms start when it go upper than 70%. So I was here to explaining how the heart attack occurs. So when the cholesterol is deposited, it's increasing more, and this intimal membrane will be burst, and the clotting occur here, and then it stop 100% block. So it will be, clotting can be in 1 minute, only 1 minute, and the blockage down. And if the patient don't receive the medical support, he can be died, or heart can be damaged. So there are types of heart attack, which normally we say silent heart attack, and there are three types, like a major, minor, and massive. And now I will explain what is the major, minor, and massive. So I will give you the example. For example, this which I draw here, if this blockage occur here on the downside, okay, so if the blockage here, then clotting start here, so heart can be damaged only this area, because it's here up, all where is the circulation is there. It can be anywhere, but I'm giving the example if it's here. So heart will be damaged on this area. So this, we can say this is a minor heart attack. The patient can have even 1, 2, 3, 4, even 5, and he can survive. This is a minor. Say, if this blockage occur there, so then this is a major heart attack, because this blockage will damage that all this part of the heart. And if he don't receive the support, the doctor support, or they don't open this, and the heart can be damaged all, and the person lead to be the death. So that's why this we call the major heart attack. And there is another which we call the massive heart attack. Massive heart attack, for example, this blockage come up here. If it's here, so it means it will block also the coronary, which is supplying on the back, and this, so this all area of the heart can be damaged. So this is a massive heart attack. So massive heart attack, the people normally don't survive. So we listen so many examples of people says he was sleeping, while he was sleeping, and he didn't wake up because he got this massive heart attack. So that's why I always talk to the doctors, especially the cardiologists. So they have to explain to the patient to prevent the heart attack, not to wait the heart attack. So how the heart attack comes. So that's the difference between allopathy and we say in homeopathy and alternative medicine, because I always advise to the patient how to prevent this heart attack, not to wait when it will come. So many, the patient, they ask me, doctor, which type of the heart attack is good for me? So I said, never. Don't wait of any heart attack. Wait that it didn't come. So now I will explain how to prevent this. For example, I can give you the example for this, like we have a bunch of the notes and there is a rubber band and I am putting the notes inside. So what's going to happen? In 2 days or 3 days, this rubber band will be broken and the notes will be out, and like same, the cholesterol will go out and it will occur the blockage. So what I have to do, I have to stop putting the notes. Oh, if I can reduce some notes to take it out, so this we call reversal heart disease. So reversal heart disease, when the patient have, then he don't have any chance to get the heart attack. So I will explain how it can be reversal or it can be stopped on this. So there are so many things, but I will explain a little bit so about the patient. If they control their cholesterol on 140 and triglyceride on 100 and blood pressure 120/80 and sugar fasting not more than 100 and after food not more than 140. So how it can be done? So cholesterol, first we need to understand what is the cholesterol. Cholesterol is the fats what we eat. Normally we found this in the animal meat and the junk foods what we eat. So this is, and triglyceride, then other fat which cause for the heart attack. Triglycerides, all type of the oils what we are eating, we are depositing in our arteries. This is all type of the oils. So it creates the triglyceride. So this is the main thing. So if we start controlling this, as I say, 0 fats, 0 oils and low salt intake. So if the person do this healthy lifestyle, he can never have a heart attack. So this is my advice to the people to control. And the other thing which I want to talk today is a very, very important. There is a very long talk, but I will just explain a little bit because I'm working on this since like 15 or 16 year, which called the silent heart attack, where so many doctors do the mistakes for the diagnosing. So when the heart attack occur, as per my investigation, there are 8,000 type of the proteins comes. But I studied on this, that there is one proteins which called FABP3, which is everyone have in the last 6-7 hours. So if we make a device which can detect this, so we can prevent, I think, 1.5 million people every year, because this, for diagnosis, we must need to know this protein is going occur. So we know that the person have heart attack, and we need to do something to melt this blockage or put some stunt, or we call spring. Another thing I want to say to the patient, so people think we did the spring or we did the tube, which we call the bypass, and we have a permanent solution. No, this is not a permanent solution. Even the spring, it can reblock after 2, 3, 4 years or 3, 4 months, I see the people. So permanent solution is how to avoid to have a heart attack, not to replace the tube. So this I say in the allopathy medicines. Allopathy is work like if we took today, it will work today. If I take the medicine tomorrow, it will work tomorrow. If I will not take, it will not work. So the best way to cure, to maintain this all levels, what I say, and this is not a very difficult, it's a very easy to maintain. Once you have note this deposited in your arteries, you don't have a risk to heart attack.